If your shoulder all of a sudden feels weak, it feels shaky and unstable, it's not necessarily a muscle thing. It can be nerve related. There is a difference between instability that and weakness that I want to clarify here. When you talk about weakness, you're talking about weakness of a muscle. When a joint is unstable, your muscle can be as strong as possible, but there is the muscle going across the joint to actually make the movement is not going to materialize because the joint itself is weak. So there is a difference between weakness and instability that we want to clarify. Now, there are cases like a connective tissue disorder, like joint hypermobility in hypermobility spectrum disorder, HSD, or EDS patients, a connective tissue disorder. These are conditions where the joints or the connective tissue of the joints are not they're faulty. Basically the collagen is faulty and the joints are unstable, so it's very easy for those joints to get subluxed or just kind of go out of whack and become unstable. These are conditions that are genetic, and these are conditions that most likely is not majority of people's issue. But I want to throw that in case you're hypermobile and you're watching this video trying to figure out how to strengthen your shoulder joint. You need to be aware of the difference there. So the other scenario that I want to bring to your attention is in case of injuries. When injuries happen, there is a there is a, you got to look into the mechanics of movement beyond that injury. Generally speaking, your shoulder joint, which I have here, is existing, and it's consisted of the arm, the shoulder blade, and your collarbone in the front. So most often, it's the mechanical problem that leads to shoulder weakness, shoulders being shaky and unstable. Most often when that happens, that mechanical disconnection, that mechanical wrong patterns of movement that exist lead to that shakiness and instability. When that happens, now we are working on the structures that are in that vicinity. Those structures can be the nerves that are in that vicinity. The nerves that go down your arm and they go to the shoulder area come from the neck, and they go to this triangle right here, and they go to your armpit, down your arm, and they do go distribute they have distribution to this region. So the weakness and instability there can come from the tension of the nerves in that area, tension or compression. And that again can very well happen as a result of instability in the area. So then the question is, how do we avoid it? Well, we obviously want to avoid anything that makes the area unstable. We want to avoid movements that are wrong patterns of movement. They're the compensation patterns of movements. And compensations only happen when we have to deviate from the ideal due to lifestyle changes, injuries, previous injuries, or the choices that we make. So what we need to do is we need to work on proper mechanics of movement, and the only type of exercises you can do to address proper mechanics of movement, to address proper principles of movement, are developmental exercises. Developmental exercises are what you and I and every walking human being on the planet Earth has done, going from being an infant to become a running toddler. No bands, no weights, no gyms, no one guided us, and yet every single one of us followed that same patterns of movement, those stages of movement. That's because those exercises bring the right body parts that are compatible and supportive in movement together to allow the movement to be nice and solid, stable and strong with proper coordination. Unless that happens, you are going to have the weakness in your shoulder. You are going to have shakiness. And instability in your shoulder joint. So address proper mechanics using developmental exercises, which is what I do in my practice, treating patients with hypermobility, which is a connective tissue disorder, and treating people with chronic conditions, which end up with dysfunctional patterns of movement. So, if this is something that you are interested in, make sure you contact me using one of the methods of contact in the description box, or just comment in the comment section of this video. Make sure you subscribe to my channel, because the whole purpose of me doing these videos is to educate you with the hopes that you will take control of your own health in your own hands by bringing knowledge and bringing awareness to what matters most. Thanks for watching.